My friend Rob, he's a firefighter, and he worked hard at protecting our loved ones for many years. One day there was a terrible accident. He fell out of a window and he broke his back. And after multiple surgeries, he was prescribed pain medications, legal opioids that you would know as Oxycontin or morphine. Months later, when he was told by his physician that he should no longer use them for his pain, it was too late. His body was physically dependent, and he had become accidentally addicted. And with no program in place that would work for him, he turned to the only place he could, the street, where the drugs are unregulated and contaminated. And within 6 months, he lost his family, he was jobless, homeless, and suffered multiple overdoses. Stories like this happen a lot more often than people would think. They can start as a workplace injury, car accident, pain disorder, or trauma. Do you know that roughly 11 people will die today in Canada due to opioid use? That's over 300 a month, or nearly the equivalent to the 2 737 MAX 8 planes crashing every single month. And how many crashes did it take until they grounded that whole fleet worldwide? 2. So why hasn't this overdose crisis garnered the same action and attention when more people are dying? Let me ask you this. What were your first thoughts when I said overdose crisis? Usually when we hear words like opioid addict or overdose deaths, our minds gravitate to the drug user who's made visible to us through their struggles with poverty, homelessness, and mental health. It's the people we see presented through the media, on TV, or in the newspapers, the ones squatting in our communities, wearing down our first responders and resources. Isn't it these stories and images that create the villain out of substance users, and ultimately they paint the picture of who we believe the user possibly is? It's not the whole story. 200,000 Canadians experience homelessness at some point in any given year. But 6 million people will develop a substance use disorder at some point in their lifetime. That means there are millions of people suffering in addiction who don't fit the profile of the homeless user. That's a tremendous amount of isolation and suffering happening behind closed doors to people of all ages, all backgrounds, and all walks of lives. Would you also be surprised to learn that the vast majority of drug overdose deaths that occur in British Columbia happen in a private residence? That could be a house just like yours. Blue-collar people with careers, your fathers, mothers, your sons and daughters, your friends, and community leaders. So initially, who we pictured to be the face of substance users wasn't correct. I'm sure some of you might be asking yourselves right now, well, who is this guy? Well, you're right on one thing. My name's Guy. And I'm the guy that battled a drug addiction that lasted 33 years, and over 2 decades of it was spent in the downtown east side of Vancouver, where I was brought back to life multiple times. It would be rare for someone today to survive an addiction as long as I did. It's just a different time, and people are dying at an alarming rate. After years of recovering, I now work as the peer clinical advisor for the Overdose Emergency Response Center, the BC Centre of Substance Use, and Vancouver Coastal Health's Regional Addiction Program. My job is to advise on the overdose crisis, and not just within our province. I've also gone across the country. Who knew that my lived experience in addiction would turn into the equivalency of a master's degree and key resume skill? I'm almost positive there's an easier way to get a master's degree. I wouldn't recommend the route that I went. It's challenging. I also go into high schools and universities and educate your children and grandchildren on substance use. I also let them know of the Good Samaritan law so that they can call 911 as a life-saving intervention for a friend who's overdosing without fear of being arrested. I listen, and they tell me that they do know that fentanyl is in now many different drugs and that it can kill, but they still use drugs for either enjoyment or to fit in or to self-medicate from their anxiety, depression, pain. I watch tears fall as they share with me of a parent or a sibling who's died of a drug overdose or is struggling in active addiction. What has changed over the last 5 years are the drugs. Today's drugs are so deadly because organized crime groups alter them for huge financial returns. They can take $100,000 worth of fentanyl and other drugs and turn it into a multi-million-dollar profit. The revenue, staggering. And the drugs are like Russian roulette for anyone that uses them. This is impacting our communities with gun violence, housing unaffordability, drug addiction, overdose. It's having a tremendous impact on our healthcare and legal systems and every single taxpayer. But most importantly, these drugs are stealing our family and our friends. This is a complex issue requiring multiple options. Look, there will always be organized crime, and there will always be people using substances. However, we need to educate our youth earlier, and we need to apply safer alternatives to reduce the harms for people who are at risk. If you look at smoking, once the risks of smoking cigarettes were widely known, creative solutions were offered to smoking. One option was the nicotine patch, which eliminates the toxic chemicals caused by cigarettes, but while still giving smokers their addictive substance, nicotine. This patch is a safer alternative. Now, for a person who has a dependency to opioids, one solution could be to offer opioids through a prescription-based program. The missing component in harm reduction strategies is safer supply programs. But Guy, you ask, aren't you telling us that opioids are the problem? I am, when they're bought off the street. In this program, people would receive a medical evaluation staffed by healthcare workers and peers and then have access to safer opioids. People would know what they are receiving and be empowered to use safely, more safely than resorting to the contaminated, tainted drug market that they're forced to go to. I often say to myself when I hear the coroner's report, we're too late. People don't recover when they're not alive. Safer supply programs could be so much more. They could be that important first step in identifying an addiction or a substance use disorder. It could actually be the starting point in someone's recovering journey. Its wraparound services to healthcare and other treatment options make it a vital asset for anyone that uses the facility. This program has the potential to save lives, reduce criminal behavior, save taxpayers money, but change the narrative of this deadly epidemic. Switzerland is often regarded as one of the most successful and comprehensive models in assisting substance users in the world. And it includes prescription opioids and, in some circumstances, heroin. Mom Stop the Harm is an organization of mothers and families who have either lost a child to a drug overdose or have a child struggling in active addiction. I've met many of these moms. Then I hear these two words consistently. What if my son or daughter had access to this safe supply program that you talk about? What if that could have made the difference? I've been to many funerals of good young kids who came from wonderful families. who slip quickly into dependency from these deadly drugs. And with no safer supply program available that would work for them, they bought contaminated street drugs. Simply a tragic reality. Safer supply programs can be one solution that we can consider and support. If someone you loved became accidentally addicted, like my fireman friend Rob, wouldn't you want them to have access to this program so that they had the chance at improving the quality of their lives? But we can also do more on our front end with our youth. What if we had earlier conversations around substance use with our children? For me, every week is Addictions Awareness Week. As a harm reduction and recovering advocate, and in the high school assemblies where I speak, I can tell by the innocence of the kids' questions that these specific conversations aren't always happening at home. Questions like, how can I help a friend? Why do people start? How come people can't stop? And are drug users bad people? And they're not talking about the homeless user. They're talking about a parent, family member, or a friend that they know, which is a terrible burden for any child to bear alone. And sometimes it's us adults. If we don't show compassion and understanding towards people who struggle with substance use and addiction, it can actually hinder our own children who could be struggling or have questions from reaching out. How would you respond or react if your child wanted to have the conversation with you about drugs? Or how do you start that conversation? It's by simply asking if they're aware of the overdose crisis, how drugs have changed, and what it really means. Sometimes we think that if we have these conversations with our children, we'll be promoting substance use. Not so. By having open, honest, non-judgmental conversations with our children, we're actually giving them the tools they'll need to make good decisions and become a compassionate ally for others who are struggling. We want to prevent them from becoming the next overdose death and the next faces of addiction in years to come. We can all do this. Let's be part of the solution. After all, the idea of safer supply programs and earlier conversations are not toxic. Awareness. What a wonderful gift to pass on. Would you pass it on, please? Thanks for listening.